Thank you. So I wanted to combine this talk and talk about image gently and image wisely, and talk about why we need to advocate that our profession is and I mean when I say our profession, the college that includes the medical physicists, the technologists, the radiation oncologists, and the diagnostic radiologists are the groups that really need to promote the knowledge and the advocacy for radiation protection principles. So I wanted to go over a few things. My goals this evening are to discuss the radiation protection principles, both for the healthcare worker and also for the patient, focusing on the patient. And I want to give this example of these two initiatives for one of many things that the ACR does to promote our professional advocacy, to promote education, and to help our profession thrive. So one of the things that I want to touch on is how the Image Gently and Image Wisely campaigns advocate for safety culture, both in the development of teamwork amongst the technologists, the medical physicists, and the radiologists, and also to develop a lot of educational initiatives that are free and available on the websites for all of us to use within our practices. It's also a campaign that is very patient-centered, and I am a firm believer that we need to always keep the patient in our minds when we're thinking about what the best thing to do is. Whenever we're wondering, is this the right thing to do? Should we be thinking about taking the next step to go in one direction or the other? I think if we keep the patient in our mind and think about our patients, we're never going to fail. We're going to win. And then the other advocacy issue we need to think about is professionalism. If we own this topic and some other topics around what's best for the patient, we're showing professionalism and we're teaching it to our younger colleagues, including many of the trainees in this room. And this is a great opportunity in Image Gently and Image Wisely, for example, to be a volunteer and to see some of the benefits and some of the real spirit of teamwork that we've had on these two campaigns, to work together and see some of the benefits that come out of it. And finally, I really believe that we're showing value add to both our patients and to the medical community, because I'll show you later some examples of how, at least with Image Gently, that this has gone out into a lot of different journals, including New England Journal and many other medical journals, and it's really raised awareness throughout the medical community. So just a review, we need to keep in mind that radiation protection principles are pretty simple in a way, and it's a really kind of a important thing to remember. For the worker, it's a little different than for the patient. So we have to remember in our mind, okay, what do we need to remember? Radiation worker, it's all about time, distance, and shielding. And so when you ask a medical physicist, that's usually what's in their mind. And when you ask a technologist, that's what's in their mind. But that's not really what we're going to be talking about tonight. We're going to be talking about what we need to think about for the patient. And that's really about justification, optimization, and dose limits. And why do we need to think about the patient? Because we, as professionals, and I'm going to talk a little bit now as radiologists here, we need to be thinking about why an imaging test is going to be done on a patient that involves radiation. And I think that we can expand that a little bit and think about our future as a profession and say that we need to think about what the cost and not just what the radiation dose is to the patient, and how we are going to be irrelevant if we don't think about justifying not just the radiation dose to the patient, but the cost to the patient, and if we should be talking to the referring physician or provider about whether it's appropriate to do the test or not. And then second, optimization, which is making sure the protocol is adjusted to the individual patient, so making sure we have size-adjusted doses. And when I was at Henry Ford today, I was very impressed by some software that they have where they have already integrated an AAPM recommendation to size correct the dose for CT, and it's called Task Group 204, and I recommend you all familiarize yourself with it. And finally, we need to think about dose limits, which are basically what we use in thinking about patients is dose reference levels, and the ACR has a few they are considering or will be able to consider more as we go forward. There are some of the European dose limits that are available for free on the RSNA ACR websites, and I'll share with you that in a moment. So let's talk about Image Wisely. How many of you have been to the Image Wisely website? Can you just raise your hand real quick? All right, so some of you. So Image Wisely was launched at the RSNA in 2010. They had a big booth. You got a ribbon if you pledged. And I'm going to go through some of the different things that they've done. So their logo is the owl, the wise owl. And the campaign is Radiation Safety in Adult Medical Imaging. Uh-oh. We lost some of the logos over here. So it's a collaborative campaign, and it was originally started with the American College of Radiology and the RSNA, and they invited the AAPM, which is the physicists in medicine, and, there we go, the ASRT, which is the American Society of Radiologic Technologists. Not sure why we lost this last person. Here we go. Okay, and the leadership is composed of Rick Morin, who is one of the 2012 ACR Gold medalists. He is a physicist and past Board of Chancellors member for physicists. Jim Brink and Don Peck, who is at Henry Ford, so he's a local. And Greg Morrison, who is the COO of the ASRT. And Greg is also a member of the steering committee of the Image Gently campaign. So it's a really good fit that he overlaps in leadership between Image Wisely and Image Gently. So it's a very simple message for Image Wisely. It's a commitment to pledge, and I'll go through the pledge in a moment, to undergo formal accreditation. And there are 3 right now deemed bodies to do that. There's the American College of Radiology, which has been doing this the longest. There is the IAC, like ICANOL, and then there is now the Joint Commission. And then participation in a dose index registry. Right now there are 300 participating sites that are participating in the CT dose index registry. And just for a show of hands, can I see how many people are in the CT dose index registry? I am. Emery is. So we just got our first report. So this is the web page for the Image Wisely site. And you can see on the right-hand side it says Take the Pledge. And this was obviously a while ago. It says 7 pledges today. So this is when it first started. It has Image Wisely on it, and you can click on it and go to the Image Gently campaign site. And it has different bars and different information for different groups, such as the professionals, referring practitioners, patients, and different imaging equipment resources. What I like about it is, similar to the Image Gently campaign, it goes through and provides resources for your different folks. So if you're an imaging physician and you want to get information like a slide talk or references about doses and how you can adjust your doses, you can just download the information for free. So the concept of Image Wisely as well as Image Gently is all of this information is free. And the same is true for the medical physicists. Some of this information is on video, so you can download the video and watch the video clips. The same is true for the radiologic technologists. There's also information that's still being built for the referring practitioners. So if you can't answer the questions for your referring practitioners, refer them to the site. The main content right now that's on this site is information about appropriateness, and there's a link to the American College of Radiology appropriateness criteria, and that access is free. There's also a lot of information about content for patients. This links directly to radiologyinfo.org. I suspect many of you are familiar with it, but I just want to point out a few things. One thing is that they have information about the patient's medical imaging record, and I'm going to show you an example of that. All of this information on radiologyinfo.org is also translated into Spanish. There's a button on the right-hand side of the homepage for radiologyinfo.org, so I highly recommend it. It not only has descriptions of all the imaging studies on it, and it has indications, and it has actually usually one image of a particular study. So for a VCUG exam, it has one picture of a little baby voiding during the VCUG, so you can get an idea of what it looks like. But it also has a lot of radiation safety information. It has dose tables, so you can get information, and you can also comment back to people about it. So here's an example of an imaging history card, and the same is being used for Image Gently in a slightly different format. But the concept is the same. Rather than trying to estimate dose, these imaging cards, which were first developed by the FDA, so this is a collaborative initiative, they just want to track, the recommendation is to just track the studies, not to try to estimate the dose, because this is a very complex endeavor. And so the physicists, the radiologists, and the technologists in Image Wisely, as well as in Image Gently, do not recommend to try to put down the dose. Just put down that you had a CT on this date and where it was performed. So it's trying to keep it simple, but track the number of studies that you've had. Another part of the website has something called a benefits risk primer, and this is for patients to help them understand the reasons why studies are done and the relative doses of the different studies. And so you don't have to develop your own brochures for your practices. You can use this instead, and I highly recommend it because I think we spend way too much time in our profession reinventing the wheel, and we should have organizations like the ACR or the RSNA or the Roentgen Ray develop these modules as one organization and then have all of us use the same. And we should standardize our message so that it's one message instead of all of us having a slightly different message and confusing our patients and also other medical organizations. There's also a partnership with the different CT vendors, and you can see the list here. So all of these sites are actually linked to the different resources that include protocol recommendations, how to adjust the CT protocols for the specific vendors and specific sizes of the patient. Finally, let's go through the healthcare worker pledge that they've developed. So Image Wisely has a slightly different pledge than the Image Gently pledge, which is simply a button, and you put in what type of professional you are, and you pledge. I like this because this has some 4 content statements in it, and they reflect, I think, some important professionalism statements. The first one says, I wish to optimize the use of radiation in imaging patients, and thereby I pledge to put my patients' safety, health, and welfare first by optimizing imaging exams to use only the radiation necessary to produce diagnostic quality images. I also pledge to convey the principles of Image Wisely program to the imaging team in order to ensure that my facility optimizes its use of radiation when imaging patients. So that's really a statement about collaboration. You're not doing this by yourself. You're not pledging that I'm going to do it, but I don't know if they're going to do it. You're saying that you're going to make sure that you're going to work with others to implement these concepts, these principles. And the first statement is saying that you're going to be patient-centered. Now, the third statement says, I'll communicate optimally patient imaging strategies to referring physicians and to be available for consultation. Now, that's about justification. And that means that we as radiologists have some obligation. We can't own all of this, but we have some obligation to think about justification. And I think that has to be partially owned by us. We have to think about whether it's appropriate to do the next CT for, when it's the 10th head CT for VP shunt malfunction in a patient in the ED, should we have a conversation about that with the ED provider? Should we tell them that, well, this child has already had 10 or 20 head CTs, shouldn't we let them know this? And hopefully there will be an IT solution for this sort of thing, so this information is readily apparent in the image ordering system with decision support. Right now, most of us don't have that luxury, and we can't give them that information up front. And then finally, the fourth statement is to routinely review imaging protocols to ensure that the least radiation necessary to acquire a diagnostic image, quality image is used for each exam. And that statement is about quality assurance and then quality improvement. So that statement says that we will look at how we're doing, because if we don't measure how we're doing, how do we know how we're doing? And so I think we have that obligation, again, as professionals, to audit how we're practicing. And if we're not doing as well as we think we're doing, then we need to look at how to improve it. And I think that's something that we've been slow to adopt. And some of our systems don't make that easy for us. I can tell you I have a lot of problems with the IT systems that I'm working with to try to get that information back. But I have some little tricks of the trade where we can do very simple, small audits to find out how we're doing. So this is just a picture on the website of what the pledge looks like for Image Wisely. And it can be done by an individual, by referring practitioners, by facilities, and by associations. So it's open to really anybody. So that was a really quick run-through of Image Wisely. They've started with CT, and this is just, I think, really important because there's been so much media attention and health policy attention, regulatory attention on CT. So their next step is to move into nuclear medicine. That module has begun. There's also discussion about moving into fluoroscopy and being able to measure the fluoroscopy dose in a better way besides measuring minutes of fluorotime. There's expansion of the web content and educational course content, besides those video clips that you can go and see by some very, very prominent people. And there's also discussion about including a JACR column under Image Wisely, which I think would be terrific. The other information that I've understood is going to be collaboration with Image Gently to implement the AAPM Task Group Report 204, and that's about size-correcting CT dose estimates. Why is this important? Because when we look at dose estimates that the machine tells us in terms of CT-DI vol and DLP, those are based on one phantom size, and we are not all the same size in this room. So that really doesn't help us when we're trying to tell our referring physicians, our patients, our family, the family members of patients, what we're really doing to them. And if we can size correct it, we can get a better idea of what we're really doing to our patients. So those that get a lot of CTs would really, I think, benefit from a better estimate of those doses. Some other thoughts that have been discussed amongst different societies is to do something around ultrasound and promoting ultrasound as an alternative, particularly in the pediatric community. And so people have suggested that we create something called Image Soundly as a campaign. That hasn't started, but there's been a lot of discussion about it. So I think there's a lot of opportunity in Image Wisely and in Image Gently, and you're going to see a lot more to come. I'm going to tell you also that the pledge now, I looked this week actually, and there are 12,548 people who have pledged. I'm one of them. I hope you will be too. So I'm going to move on and talk about Image Gently, which I am very familiar with, and it's really been a pleasure to work on this campaign. And I'd say it's been a work of love for a number of us in the Society for Pediatric Radiology and a number of other members. And we really started this many years ago and didn't really get it off the ground for a number of years because we weren't sure how to do this. And I'll tell you that if you think about it, a lot of us are afraid to talk about radiation dose. How do you talk to your patients about something that you really you can't see, you can't feel, you can't touch? And we're not really trained about how to do this. So there was a lot of hesitation on all of our parts. And we certainly didn't want to scare people from getting what they needed. So it took a while for us to figure out how to do this. And yet we felt it was important to do. So we created this campaign. We wanted to educate, we wanted to increase awareness, and we wanted to advocate for children. We wanted to promote radiation protection for children, and we wanted to make it a worldwide campaign. Very early on, we said this is not going to be America-centric or North America-centric. We're going to open it up to everybody, and the goal is to really harmonize the radiation protection message. So the founding organizations are a little bit different from Image Wisely, but they're very much include the American College of Radiology. So the Society of Pediatric Radiology reached out to the AAPM, the ACR, and the American Society of Radiologic Technologists. The chair of this group is Marilyn Goski, and if you've ever met her, you'd love her. She is at Cincinnati Children's Hospital, and she's been a real force behind this organization. There are over 60 affiliate regulatory groups, societies, organizations, and it is very much a volunteer group. A lot of people volunteer their time because they want to make a difference. If you want to sign the pledge, this is the website. You have to click the button that looks like this up here, except it's round, and there are about 11,000 people that have pledged. I will tell you that pledging is a concept that outside of America people do not like, so I haven't had a lot of luck with the concept of pledging outside of the U.S. I think it's very odd. So what are we trying to do with Image Gently? We're trying to accelerate change. We're trying to communicate in a very different way than we've communicated amongst ourselves. We want to alter societal attitude. We want to increase knowledge very much. We want to change behavior at point of care. And we want to benefit our pediatric patients. So the way we decided to approach this was very much to engage the media, and that was a little bit scary for some people. They said, "You're nuts. You talk to the journalists?" And we said, "Yeah, we're going to talk to journalists." So we looked for every opportunity we could, and that meant working with the wonderful American College of Radiology media folks. Sean Farley is a gem, if you don't know him. There are a lot of media also training modules on the website if you ever need them, or you can contact him and if you ever have concern and you ever do have to talk to media. There's wonderful training that I recommend to you. And then we wanted to do public education, and we worked with the CDC, the EPA, and the FDA on that. And we also wanted to do what is called social marketing. And the CDC is amazing at this, as is the EPA. So what was our target audience? Well, we wanted to go after the public. We wanted to go after health professionals. And we wanted to make sure all stakeholders were included. And we wanted to use all kinds of media, mainly the website, because we couldn't get everybody together at the same time. But we really wanted to hit everything we could and think of every way that we could get our message out. So when we decided that we had a module together, like CT scanning, we wanted to be able to publish in our journals, the big journals like AJR and Radiology, but we also wanted to put out posters. We wanted to put out like a sticker in the journal, and we wanted to, have a booth at the RSNA, and we wanted to give lectures at different societies and do everything we could to get the message out in a way that people heard it. So what was the why? Why did we need to do this, or why did we feel we need to do this? Well, I think the timing was good. We started the campaign before the National Council for Radiation Protection produced this report in March of 2009. So this is 3 years later from this report. How many people have seen this report? Okay, good. Some of you have. So the National Council for Radiation Protection is probably not a very well-known organization, but it's a congressionally funded 100-member body that looks at all of the health hazards from radiation to the American public. So after 9/11, it got kind of distracted and did a lot of reports on biohazards from nuclear power, from airlines bringing in hazards from ships and containers, and anything possible that terrorists could do. But finally, later on, there was a look at different sources of public exposure, and this report really surprised a lot of people, certainly including me, and it caught the eye of a lot of policymakers. And what they looked at is what the total population exposure was, and this is averages, from the early 1980s. And they said, okay, most of us just have background radiation, which is, what we get from rocks and radon and cosmic radiation, and that makes up most of what we get. And we only get about 15% of our total annual radiation from medical uses, like an X-ray or a CAT scan or a nuclear medicine study. And so that total comes up to about 3.6 millisievert a year. So it's about 3 millisieverts of background and about 0.6 millisieverts from medicine. And that's in the U.S., so it's going to vary from country to country, right? And it's much higher in places like Finland, where they have more rock, and lower in other places. So just keep that in mind. But that's what it is in the U.S. And then fast forward to 2006, and you look at background, it stayed the same. And you look at medicine, and it's gotten a lot bigger. And so now medicine is about equal to background, and you've gone from 3.6 millisievert per year per person to 6.2. So that's a huge increase in a pretty short period of time when you look at human history. And so people said, well, how could that happen? What did we do? And about 50% of this increase was due to CT scanning, and almost all of the rest was due to cardiac nuclear medicine imaging, which I think is interesting. And this is diagnostic medical radiation. This is not radiation oncology. And so I think that this really caught the eye of a lot of people, and they started saying, well, what are the health benefits from this? And we didn't have any proof of, or very little proof that we had improved outcomes in our population. Now, that being said, you could argue, and I would argue, that we certainly have some evidence that we have better quality of life. We don't do exploratory laparotomies for abdominal pain. We know when we have appendicitis, right? So I think there is some health benefit. We all know that CT is an amazing tool, and we also know that the leading internal medicine docs in this country rated CT and MRI as the best medical innovation in the 20th century, right? Now, personally, I would rate pain control in birthing babies as number one, but I would put number two CT and MRI. So what do we know about children versus adults? We know that they're more sensitive to radiation up to 10 times. The younger they are, the more radiosensitive they are because of their cell growth. And I saw that Eric Hall was one of your speakers a few years back, and he wrote about this eloquently. They have a longer life to express those changes and get cancer from radiation. Okay? And we also assume, and I'm saying assume, this is controversial in the United States, and at least in our community, that radiation dose is cumulative, and a large number of imaging exams of the same body part increases total dose. Now, I'm going to say that the National Academy of Sciences and the Beer report from the Hiroshima studies and the International Council for Radiation Protection believe that radiation dose is cumulative, and there is risk from cumulative doses. So I'm just going to say that, and you can think about that. Now, we can't measure radiation patient dose, So we have a hard time talking about it. And in the JACR in 2007, I'll just read this quote: "The determination of radiation dose to a living human from an X-ray exam is very complex." So I always tread into this with trepidation. And what Rick Morin has said over and over is that we shouldn't be saying we're talking about dose, we're talking about a dose estimate. Okay? And I want to remind everybody why, as I said earlier, we have problems talking about it. Because we can't see it, we can't measure it, it has effects that are very delayed. And on top of that, our background rate of cancer in the U.S. is 40%. So you can see it's very hard to design a trial to see the effect of low dose from CT or interventional radiology on our population. However, I will say that there are 6 right now prospective cohort studies looking at infant and pediatric CT and the risk of cancer induction. None of them are right now in North America, unfortunately. So this was the why that I think started the Society for Pediatric Radiology and Image Gently. It was asking ourselves, how are we going to answer parents when we see articles in the USA Today from 2001 that picked up the papers in the AJR that were published in early 2001? They started writing about this a long time ago, and it's really hard to answer, and we still don't have an answer. We don't know. But Image Gently took the position that it's better to be conservative and to try to prevent, to be preventative, and to say, well, I'd rather be wrong 20 years from now and take the stand that it might, that CT or the radiation that we deposit in children might cause cancer, and be wrong, and say that we did everything we could do to be careful and protect the children that we're treating, and educate the families. I would really rather be wrong, but I'd really not want to be in the position that I'm being cavalier and I don't really think that it's causing cancer and not pay attention to it. So I think that's the stand that we take, and you can decide how you want to sleep at night and where you want to be on that. So these papers looked at, I don't know if you're old enough to remember this, but these papers looked at outside studies that pediatric hospitals were reviewing and how there was no dose adjustment for children based on CTs that were done in community hospitals. They didn't adjust the dose from adult protocols to children. And we know that that's still happening, but it's happening a lot less. And the other problem is that we still have incidents like this where a toddler who fell and had a head and neck CT in California had 151 scans, and it's really a true statement, and had a very, very high dose, went through the eyes, so is certain to develop cataracts in the next few years. And the real lesson from this is, why do we have such safe systems when we go to the gas station and can't overfill our car with gas, but we have a CT scan that you can buy and the technologist can keep hitting the button over and over? Why does the FDA allow that to happen, or why do our systems not have safety mechanisms? And so thankfully the FDA has been working with us and is willing to think about these things now that these unfortunate, very media-intense events have happened with the stroke, CT overdoses, and the hair loss, and this event. It's unfortunate that it's had to have these very, very media-intense events to get the attention and to have the public unhappy that the vendors are paying attention. And they should. They should have some responsibility for helping people who are human and make mistakes, have some preventative systems in place so that this doesn't happen. And I'll just say parenthetically that this hospital did not have an accredited facility, and their technologist was not credentialed. So I'm just saying that sometimes having these programs in place can perhaps help prevent these errors too. So what's the history of Image Gently? We made a commitment, the Society for Pediatric Radiology, to get it started. In 2007, we had the founding partners meet. In the fall, we started forming partnerships, and we got the American Academy of Pediatricians to join. And we had our very first rollout, which was the CT module, which was, we thought, the most important, given that 75% of radiation dose in children is from CT scanning. We do a lot less nuclear medicine in children. And then we had a CT vendor summit where we tried to get them on board to work with us to try to do that size-corrected dose project and some other projects. And then we started looking at parent brochures and produced parent brochures and published in the pediatric literature. And that was followed by a summit about emergency department use of CT and trying to ask them, what are their incentives to use CT, whereas from the radiology perspective, CT may be overused in that environment. And we knew that some of their issues are medical legal, throughput, they don't have the history on the patient, things like that. So we worked through some of those issues. And then we rolled out some other campaigns like Step Lightly in interventional. So there's some interesting materials. All of these things are free about how to do interventional procedures in children, which include checklists. So we're trying to use the safety, culture, techniques and make them available so that before you do any procedure in a child, you go through this checklist. There's information for parents about what to ask. Such as, is your facility accredited? Are there alternatives to this test? Things like that. We then follow that with a plain radiography summit. The goal of that summit, for example, was to bring the FDA in and to have all 11 vendors internationally come. This was held with Mallinckrodt co-sponsoring it. And we wanted to actually get one type of metric to display to all of us so that we knew what the quality index was. And all of the vendors use a different way of saying what the quality index is. And the gist of the summit is that we would like it to just be the exposure index, and hopefully we'll move more and more toward that direction. It hasn't been finalized, but it'd be really great to have only one way that we all speak about the quality index for each plain film vendor. We then had an FDA vendor summit, and they were very, very interested in getting all the CT vendors to work together so there would be some triggers so that when the technologists put in 600 MA, there'd be a warning. And all the new machines have that. They are not retrofitting all the old machines for that. So they were very interested in doing that. And then we rolled out in February of last year a Pause and Pulse campaign, and that was about fluoroscopy. I don't know if any of you saw that, but it was on Valentine's Day that we had an email rollout, and the butterfly it looks like a Valentine. And finally, in the fall, just around RSNA, we had to go with the guidelines, which was about nuclear medicine doses. And this was a real effort to try to get nuclear medicine doses, including the PET doses, to be adjusted for children. And so I'll show you a picture of what that looks like. The Image Gently message for CT was very much to start with, for example, CT helps us save kids' lives. But did you also know that when you image, radiation matters? Children are more sensitive to radiation, and what we do now lasts for their lifetime. And so we had just a few things to remember. And we said, when you image gently. More is usually not better. So this is the ALARA principle. When CT is the right thing to do, child size the KVP and the MA. One scan, so single phase CT imaging is usually enough. And that's pretty well, I think, often true in adults. And then scan only the indicated area. So we've been trying to look at overscanning in our technologists. And I think the ACR Dose Index Registry, when you look at the DLPs, you'll get an idea of how much overscanning is being done by your technologists. So it's a good tool to look at that. So this is an example of what the brochures look like. It's just one. But I want you to notice, this is a CT brochure, that the colors are very pleasing. We've got always smiling people and children with other people. We've got butterflies. And it will say, what is an X-ray? It's an 8th grade level language. And it actually goes through and it says, what is the risk of cancer? So it's explicit. And it gives websites for further reference. And I encourage everyone to look at these because we now have 18 language versions. And these are volunteers that do the translations. And we don't let just one person do it. We always have at least a team of 2 people so that we can try to get the language translation right. And I encourage people to use them in radiology departments, emergency departments, and in pediatric offices. We have similar ones for radiography and interventional. For those of you that haven't seen this, we have thousands of people that have downloaded these universal CT protocols for the abdomen and for the head. And if you use your baseline medium-sized adult protocol, you can use these MAS reduction factors and multiply whatever it is your MAS is in your adult by this factor for the approximate age that you have here. So say you're using 100 MAS in your medium adult, you would just, in a newborn, multiply that by 0.31 and get 31 for your appropriate level for your newborn. So that's just a way for you to very simply translate into a lower dose. Now, I've seen plenty of criticism about this because, it's only looking at MA, but it's too simple, or other people are using lower dose than this, and yeah, that's true. But it's a good way to simply start lowering your dose. There are also some dose protocols for adults on the AAPM website that are, I think, commendable. Another thing you can do to help your technologists is tell them to look at these CT modules. There are 8 of them. They're free and they can get CE credits. These are for all the vendor types. So we've got, well, not all of them, but we've got the 4 main ones: GE, Philips, Siemens, and Toshiba. And they can listen to these online. Another thing that is on the website is a PQI module for pediatric CT, so you can get for your MOC requirement, you can do one of these. Jim Brink has also done a chest CT PQI on the Roentgen ray, and Jim Brink and I are in the process of doing these for all the adult body parts. So we're doing head, neck, spine, and abdomen, pelvis. So in this year, there should be all of those on the Roentgen ray website, which talk about dose and optimization. So this is a picture of, again, of messaging and why we want to use non-threatening images and get these messages out. This is the Pediatric Interventional Radiology Educational Campaign. We have a simple message. We have that checklist, a parent brochure, protocols for how to do the studies, and other references for folks. These are 2 of the materials for the nuclear medicine module, and these are posters that you can get off of the web. This is the poster of the actual doses recommended for different studies like PET, bone scanning, and it has comments over on the right-hand side for special information. Again, it says go with the guidelines. It's got the butterflies. It's very friendly. And I think that you can put this on the doors of the different areas of the nuclear medicine rooms. The technologists really like these. This is a poster about trying to encourage compliance or getting people interested in it. And this girl, by the way, is Nora, and she's been in all of the campaign from the get-go. So she's gotten bigger as we've continued with our campaign, but she's the daughter of one of the steering committee members, and it's just been really neat to see her grow up with us. when we worked with the FDA on the rollout with the plain radiography, one of the things that came out of our summit was to come up with a checklist to help the technologists when they're doing portable radiography or they're doing in-department radiography, remember to do a certain number of steps before they do the x-ray. So checklists are really, really important because our day is very distractible and we get interrupted a lot, and technologists certainly get interrupted a lot. So we came up with safety steps to do and verify for your pediatric patient. And I will submit to you that if you look at this carefully and you can go on the website and look at it and just erase pediatric, everything on this checklist you can use in the adult patient. So I recommend it for all your patients. And just you can do this and you can actually have training around this, and you can also audit on this. So I think it's a really nice tool to have people look at what they need to do before they start the exam. So, it's the two-patient identifier for the Joint Commission, and then image capture, and it does recommendations for beam collimation, image critique, and then completion of the exam. Some of the other things I just want to remind people of is working with the referring physicians. They need to understand why this is important, and we were very lucky that the pediatricians were very interested in this, and we've had them write editorials about this. So they very much wanted the information. So they've published information in their newsletters. We've done a dose training module for them. So we've done a PQI module for them, and we've published in the AJR and in other journals. So how has Image Gently been recognized? I just want to mention a few things that are kind of neat. The Image Gently was named the most influential force in the RT Image magazine, which is the journal for the technologists. So I thought that was really neat, and it's been recognized a few other times in their magazine. And then the U.S. House of Representatives had a resolution. It's a non-binding resolution, but it's a resolution nonetheless. The state of North Carolina, due to Don Frush at Duke, has also had a day that's called Image Gently Day, which I think is great. And then AntMini.com has an awards. I didn't know this either until we got one that's called the Most Effective Philanthropy Program for the Pause and Pulse Fluoroscopy Campaign. So I think it's really neat that there's a lot of recognition and people really do think these things are important beyond just the radiologist community. So this is the picture of the Pause and Pulse sticker that was in some of the journals that came out last year. This is the heart-shaped butterfly. And then I want to mention one other thing. In all of 2011, all of your Landauer badges, hopefully you noticed, had Image Gently on it. So we decided, it was a risk, but we decided we would partner with Landauer to promote Image Gently. And I don't know if you can see this on here, but it says Pause and Pulse, and it's got that little heart-shaped butterfly on it. So we were trying to get the word out, and a lot of people liked it. Another thing that the American College did on behalf of Image Gently was to promote a safe practice. For people that don't know the power of this organization, they set a lot of our PQRS metrics, whether we like it or not. They set a lot of the metrics that the hospitals and health systems are asked to submit data on. So some of those are directly affecting us, that we are having to report data, and it's now transparent on the Medicare and Medicaid websites. So when you go and look at our rates of doing CTs with and without contrast for chest and abdomen, this is from the NQF. They're setting these standards, and some of them I don't like because they don't have necessarily radiologists internal in their organization. So I really ask you all to think about getting involved if you can, or if you know people in your organizations that are involved, to have lunch with them and explain what radiology is and what radiation safety is, because they really don't know. So it's really important that we stay involved with these different groups. So they have this national initiative, and it's Safe Practices for Better Healthcare. And they only have 34, and I think I have this up, yeah. And they added this 34th one in 2009, which was when CT imaging studies are undertaken in children, child-size the technique to reduce unnecessary exposure to radiation. And this is a big win, because these are national metrics, or national resolutions in NQF. So, we thought this was quite a big thing. The only other imaging safe practice that was put in by NQF was related to contrast-induced nephropathy. So they have a safe practice around that as well. The last thing that Image Gently is really pushing is international collaboration. And why is this important? Well, because we're really want to be a part of international collaborations and to standardize what we're trying to do in terms of guidelines and in terms of dose measurement. For example, just trying to get the vendors making CR, DR, plain film equipment to come to the table and to talk about one way to report out the way that the quality metric is done. I mean, that's to me a good enough argument about why we need to think internationally instead of just about North America. So, but beyond that, we do collaborations with the World Health Organization and the International Agency for Atomic Energy. And I know that sounds weird to work with the IAEA because we have nothing to do with atomic weapons, but oddly enough, they have a lot of money compared to the WHO. Sadly enough, they have a lot of money compared to the WHO. And so they actually have the world's best, I believe, website on radiation protection of patients. So if you Google RPOP, you will see an amazing website about radiation protection of patients. And Image Gently is collaborating with them to help them do information for patients and for healthcare workers. They have, I think, a really interesting one on cataracts, and there's new literature about cataract risk for those interventionalists out there. The risk is higher than we thought, and they have good data about it. And so I recommend that we understand what they're doing to help educate the world community about radiation protection. I'm working with them to look at pediatric practice of CT, and others are doing site visits where they send in a physicist and a radiologist as a pair, which I think is a great concept, and they send them out to different developing nations to look at their practices, how they track dose, and then they follow up and they send surveys to all these sites and say, okay, how good is your equipment? How are you measuring dose? And what are your protocols? So I think that's very interesting, and no one's actually looked at this. So they have the resources to do it. And the other thing that we're working on is trying to develop a network to harmonize some very simple guidelines for developing nations so they can do some simple things like, do you do 2 views of the chest for pneumonia in children? You don't really have to. You can do 1 view. So just things to help them with some very simple approaches. So I want to conclude by saying that we really must understand radiation protection principles. I want us to own this. I think we do, and we need to continue to own it and to share what we know with the medical community and with our patients. We want to recognize the benefits of ACR advocacy. This is just one small example of what the ACR does. The ACR has 400 staff members and many, many other programs and initiatives. But these are some of the benefits. We build a safety culture by doing this advocacy. We build teamwork and educational initiatives for everybody, and hopefully we don't have so much redundancy in the efforts that we're all doing. We provide patient-centered care, which I think is so important in messaging out what our profession is trying to do. We demonstrate professionalism because we're taking care of the problems that our patients face, and we're not ending up with government regulatory people trying to come in and clean up messes that we know how to fix better than they do. We're displaying to everybody the value add of what we can do to help patients in the medical community understand what radiation is and how it can be managed and how it can really help the imaging, CT in particular, can do tremendous things. And I hope you all will think about what I've just shared with you and become a volunteer with the ACR. So thank you very much. And I hope you have questions.